is Sarah Rae. Welcome back to my channel. I hope you all are doing well. Today we are finally doing it. We are doing a dedicated video on the topic of PTSD. I've made some other videos on the symptoms of PTSD, such as flashbacks and nightmares. I've also done some videos answering questions about PTSD, but I haven't done the standalone information on PTSD. So here it is, right here, right now, this video, information on PTSD. I hope you guys are ready. I know I am. Let's just jump straight into it. You know the drill. Like, comment, subscribe. Hit the bell for notifications of when I upload, and let's jump into this discussion on PTSD. Look at my bug, my little Harley bug. I got my drink and I got my bug. She's so cute. You know, she was laying on my laptop earlier. I was like, I gotta record. How am I supposed to work? How am I supposed to do YouTube if she's sleeping on my laptop? I can't disrupt her when she's sleeping. She's so cute and precious. My heart. Until she moved and I was like, okay, now I can YouTube. But I'll show you a picture. It's so cute. But anyways, let's talk about PTSD. What is PTSD? That's where we're gonna start. And it is a serious mental health condition that develops after a dangerous, shocking, terrifying event that is called trauma. And it used to actually be called shell shock. Try saying that. It's tongue twister. Or battle fatigue syndrome for war veterans. Actually, it wasn't until quite recently in our history did they look outside of military to realize that other people could have PTSD. And if you want to actually look at statistics, 1 in 13 people will develop PTSD. And 20% of people who experience trauma will develop PTSD as well. And in America, 3.6%, or if you want to put that in not percentage, that's 9 million people, are affected by PTSD. How does PTSD happen? During trauma, the body responds to threat by going into fight or flight mode. And during this time, the body releases a stress hormone like adrenaline, which gives your body this energy to react. The brain during this time puts normal functioning tasks on pause, getting stuck in this danger mode. And it will send out these stress signals, which ends up being these PTSD symptoms. You know, I found something that was quite interesting that I wanted to note in this video, is that there is a discussion going on that they're looking at PTSD as not so much a disorder per se, but as a variant of how the human responds to trauma. No matter what symptoms and what we deal with, there are consequences of our body's inability to return to normal after a traumatic event. So I really don't get why there's this argument. We still are facing trauma. But I'd love to hear your thoughts on this discussion. Okay, symptoms. They can take a month to appear after the event. They can take up to years for some people to appear after the event. Mine, I have PTSD. After my trauma happened, I blocked it completely out of my memory. I acted like it didn't even happen, and it took years for it to appear, and when it did, it took the form of nightmare. And we are going to talk about different type of symptoms and even triggers here in a moment. And I also want to remind you, and I will reiterate here in a little bit this too, but everyone's symptoms vary person to person. So, and that goes for intensity of symptoms as well. But yes, they can take a month to appear for some people, and they can take up to years. Symptoms are generally grouped into 4 types. The first one being intrusive memories or re-experiencing memories. So these are for those who have PTSD that repeatedly relive trauma through thoughts and memories. These include flashbacks, hallucinations, nightmares. They also feel great distress when reminded of the event. So think of during the anniversary of the event, they feel great distress. So to be a little more specific, think reoccurrent unwanted distress memories of that event. So flashbacks and nightmares again, and think severe emotional distress or physical reactions to the reminder of that trauma. Those are intrusive memories. The next type of symptom group is avoidance, and this one, people may avoid people, places, thoughts, or situations that remind them of that trauma. So to be more specific, they may avoid thinking or talking. They also may avoid places, activities, or people too that is a reminder. The next type is negative changes in thinking or mood, or it's also known as cognitive and mood. So these include excessive emotions, even suffering from physical symptoms to like increased blood pressure, heart rate, muscle tension, and diarrhea. So I'm going to read from my notebook of the type of situations that fall under that category. So think negative thoughts about self, people, or world. The next one is hopelessness on future. Memory problems, including not remembering important aspects of the event. Difficulty maintaining close relationships. Feeling detached from family and friends. Lack of interest in activities you once loved. Difficulty experiencing positive emotions. And feeling emotionally numb. The next one is changes in physical and emotional reactions. This is also known as arousal symptoms. So this refers to thoughts and feelings related to blame, estrangements, and memories of traumatic events. Again, I'm going to read from my book because it's quite a few. So think being easily startled or frightened, always on guard for danger, which is called hypervigilance, self-destructive behavior, trouble sleeping, trouble concentrating, irritability, angry outbursts, overwhelming guilt or shame. For children under 6, symptoms can include reenacting trauma or aspects of the trauma in child's play, or having frightening dreams that may or may not include aspects of trauma. And again, I want to reiterate, symptoms and triggers vary person to person. I want to go a little deeper with the symptoms. I found a list of 17 symptoms of PTSD, and I'm going to give them to you. I'm also going to tell you my experiences with PTSD, so on this list, if I have any of them, I'm going to let you know and tell you a little bit of my experiences with them. So 17, let's go. First one being intrusive thoughts. We've just talked about them, which I very much do get in the forms of nightmares, which is number 2, nightmares. I also get intrusive thoughts by reliving. I don't get full-blown flashbacks, but if I'm triggered in any aspects, I relive in the form of audio and feeling. So I don't see it, but I hear it and I can feel it, and it's very, I have no words of what it's like. It's terrible. It's terrifying. So the next one, again, is nightmares. I get those. I'm on medication for that, which we are going to talk about that a little bit later. The next one is avoiding reminders. Of course, everyone's going to avoid reminders. You don't want to be reminded of the trauma you went through. Number 4 is memory loss. I don't really have memory loss. I mean, do I remember every little detail? No, but that's because my trauma, it went on through 3 months. So I'm not going to remember every little detail, but I don't think I really have memory loss. Number 5 is negative thoughts on self and the world. Yes, I can get these at times. I've been through therapy and I'm going through therapy, so I had to learn not to always do this. And it took a while and I'm still working on it, so yes, I very much do feel down on myself and it happens. 6 is self-isolation. Yes, it just feels easier to isolate yourself than to be out in the world. We are going to talk about hypervigilance here in a moment, but you are very hypervigilant, and what that means is always on guard and constantly aware of everything, and it's very stressful. Number 7 is anger and irritability. I can get very angry really fast, but also I have BPD, which is borderline personality disorder. I'm very overly emotional. So yeah, I get angry a lot. Number 8 is lost interest in favorite activities. Yes, I have, because you just don't feel interested in anything anymore. You don't have that drive in you. It's just gone. I don't know how else to explain it. Number 9 is hypervigilant, and we already talked about that. And yes. Number 10, difficulty concentrating. I don't so much have this one, but if I'm out of my room and out in public, then yes, because of hypervigilance. Number 11 is insomnia. I am very much an insomniac. I take medication for it, but it isn't so much because of my PTSD. It's because of working night shift and being in the hospital all the time and not being able to sleep because of that. And I'm sure it has a little bit to do with like nightmares, getting those and not wanting to sleep because of it. So I'm sure it has a little bit to do with it. Number 12 is vivid flashbacks. I do not get vivid flashbacks like that except for my nightmares, but like I said, I get audio. So when it comes to flashbacks, I do have a video on that. You can get sight, audio, and nightmares are the type of flashbacks you can get. I believe are the only ones. I may be wrong. I don't quite remember. I'm sorry for if you can hear the outside noise. Number 13 is avoiding people, places, and things related to your trauma. Yes, there's places around the city that I was taken to, and I avoid them like crazy because it triggers, and we're going to talk about triggering. We're going to talk about triggers here in a moment, but so it sets off my alarm, which we are about to talk about, and makes my body go into that fight or flight mode and puts me into audio flashback or some form of a symptom. Number 14 is casting blame, and this is a very common symptom that a lot of people with PTSD feel and will have. And yes, I get this. I cast blame on myself all the time, and I'm working on it, but it's hard. It's hard. Number 15 is difficulty feeling positive emotions. And I mean, sometimes. Number 16 is exaggerated startle, and that is like being very jumpy. I can be, because of being so hypervigilant. I can get very jumpy, but number 17 is risky behaviors. Those are the 17 different symptoms you can get of PTSD. Now, you can't talk about PTSD without talking about triggers, like I said. So, triggers can be sight, sound, smell, or thoughts that bring back the memories reliving that trauma. So, How do triggers develop? And I mentioned this in my flashbacks video, but I want to say it again here in this video. And it can be kind of complicated, a little bit hard to explain, so stick with me here. Okay? The brain has multiple key players that play a role in how PTSD happens. But we're only going to focus on two, the hippocampus and the amygdala. First, the amygdala is mainly working with emotional memories, like forming fear-related memories. The big thing here is that it is ensuring your survival by strongly encoding memories of the past dangers so you can recognize them and respond differently. The hippocampus is like the brain's historian. It catalogs all the details of your memories. So these two work together to turn experiences into long-term memories. Now, when a threat happens, things work differently. Your body again goes into fight or flight mode, and the amygdala works while the hippocampus suppresses. When the threat passes, you are left with strong negative emotional memories of that experience, but lack clear recollection, so you associate sight, smell, sounds from that traumatic event, but are unable to recall how that event went completely. So later on, when you encounter a trigger or reminder, the amygdala retrieves that memory and signals danger, activating the fight or flight mode. You're reliving that trauma again. Because the hippocampus isn't working correctly during the traumatic event, the memory wasn't stored properly, so there is no feedback system to tell the amygdala that you, in fact, are not in danger. That's how triggers are formed and lead to symptoms. I hope that makes sense. If it don't, let me know, and down below in the description box I'll write out the easy description for you guys. But there are different types of triggers. There's people, thoughts and emotions, things, situations, scents, places, TV shows, reports, movies, feelings, sounds, tastes, anniversaries, words. I mean, anything can be a trigger. What is the cause of PTSD? Well, it is unsure why some get PTSD and some don't. But it is believed that it has to do with a complex mix of stressful experiences and inherited mental health risks like anxiety and depression, your personality makeup, and the way the brain regulates chemicals and hormones in response to stress. Let's talk diagnosing. They don't tend to diagnose PTSD until a month after the traumatic event has passed. If symptoms are present, the doctor begins a medical history and physical exam. Sometimes they'll draw blood. They do this just to check if there is a physical illness going on, and if there's not a illness present, then they may refer you to a psychiatrist or psychologist, which they have designed interviews and assessment tools to evaluate a person for the presence of PTSD. It is quite interesting, actually. I remember how I was diagnosed. So I had a side effect to my depression medication, and while I was in the behavioral health unit, they had me look for a psychiatrist, and I did, went to see him. It was a guy. I didn't feel comfortable telling him about my nightmares or what they were about, but he did have me see a therapist in the office. Still see her. She's incredible. And I finally told her about them and what they were about, and they worked together and finally diagnosed me with PTSD. And that wasn't even something I thought about, or even really, it wasn't anywhere on my radar of what could be causing my nightmares, or that it could be somebody who would have it, so. Let's talk about complications. So some complications you could get with PTSD is depression and anxiety. You could get drug use, alcohol use, EDs, and also the S word, tendencies. If you don't know what that means, it is on the screen now. Those are a few complications that can come with PTSD. Let's talk about treatments. The video is long as it is. Treatments, they are to reduce emotional and physical symptoms, improve daily functions, and manage trauma. So there is no cure for PTSD, but therapy is a big role in PTSD. So one therapy is psychotherapy, which is a way to manage symptoms and learn coping skills. The next one is CBT, which is incredible. I have learned so much through CBT, like grounding skills, which is a huge help. I will leave a link to a website for grounding skill in the description box down below. But CBT helps you recognize and change thought patterns, so it's really, really great. The next one is prolonged exposure, which has you reliving the trauma in a controlled environment, is to help you confront your fears. The next one is psychodynamic, and that helps you examine personal values and emotional conflict. The next one is family therapy and group therapy. Group therapy is also a wonderful therapy for PTSD because you are surrounded by people who also understand what you are going through. The next one is EMDR, which is eye desensitization reprocessing. This alleviates distress associated with trauma memories. So I've started doing this, so I can't really say much about it yet, but they have had great success with this. Another thing that they do with PTSD is medications, giving antidepressants. They also use blood pressure medications to help control other symptoms, like Prazosin, which is for nightmares, and I'm bringing that up because it is a medication I take, and it is also listed on some websites when they talk about treatment and things that is given for treatment. So it is a common medication for nightmares for people who have PTSD, and Prazosin helps me a lot. I don't have nightmares as often as I used to. It helps me a lot. There's also other medications that is given for sleep and memory. And the last thing I want to add is, if you're watching and you want to know more ways to help somebody who has PTSD, some other ways you can help is getting them social support, because that is huge. Having a support team for them is everything. Don't pressure them into talking. When they talk, that's when they're comfortable. Doing normal activities. Don't walk on eggshells around them, and treat them normal. Get them to do activities, because some days they're not going to do it themselves, so get them up and moving. They will also give you clues on the best way to help. I know for me, I've told my boyfriend, ways to help me on when I'm in a certain state of mind where I can express the best ways to help me. A big one is to manage your stress and to take care of you, because you can't help someone until you are calm and okay yourself. Be patient. It is going to take time for them to be in that space where they feel comfortable to open up or to live, to do something. So be patient. Educate on PTSD. I always believe that educating yourself is so important. I educate myself on everything I can when it comes to myself and my mom and my dad, whoever is important in my life, so I can help them to the best of my ability. Accept and expect mixed feelings. You will go through a complex mix of emotions when dealing with someone you love that has PTSD. It's just gonna happen. My little bug is laying right here on my laptop again, so be a good listener. And in that case, they may tell you something that may be hard to hear, or they may tell you something over and over again, but that's a good thing. That means they're opening up and they're working through it. Be there. That is important. Create routines for stability. Empower them. That is so important. Be trustworthy. Figure out what their triggers are so you can anticipate and manage them. That is probably the most important one as well. That is probably one of the most important ones as well, because knowing what their triggers are allows you to live life with and be able to take them out, go places, and be able to not have an issue arise, not have a flashback or anything like that arise, not have anything like that happen. Also, support therapy. Try, if they're not in therapy, try to get them into therapy. Frame it positively. And if they are, continue to support that for them, because therapy is so important to get them to that place where they can live life again. If they are angry, stay calm, give them space, ask them what you can do, and most importantly, remember safety is number one. Safety for you and safety for them. And then again, take care of you. So those are the main things I have for you about PTSD. I hope you found some great information or something you may not have known about PTSD, or something that'll help you with a loved one. Let me know if you have any other information in the comment section down below, or if you go through PTSD, let me know your thoughts, or you can email me if you don't want to talk about it in the comment section. My email is always in the description box down below. PTSD it's one of those things where there's no words to describe what it's like to go through. So if you go through it, my heart is with you, because I get it, I understand, and I walk that journey with you. If you need somebody to talk to who understands, a support buddy, email me, because I never want any of you guys not to have somebody. So thank you guys so much for watching. Stay safe and well, and I will see you guys in the next one. Bye.